Hi, my name is Caitlin Bernhard. I'm a cannabis nurse practitioner and the owner and founder of Azala Wellness, a cannabis consultation and education company based out of Western Massachusetts. This presentation is recorded, but I will be available live for the chat Q&A and for questions after the presentation. Today I'm going to be talking about drug-drug interactions and cannabis. So, drug-drug interactions, or DDIs, are when one drug affects the action or side effects of another drug. Older adults are at a higher risk for DDIs because of polypharmacy, which is the use of multiple drugs or more drugs than are medically necessary, comorbid conditions like diabetes and heart failure or chronic pain and diabetes, and age-related physiological changes, changes of speed of metabolism, for instance, or permeability of cell membranes. These age-related changes can affect pharmacodynamics and pharmacokinetics of medications. The two main categories of DDIs are these pharmacodynamic and pharmacokinetic drug interactions. Pharmacodynamic interactions are when the pharmacological effect of one drug is affected by another drug. This can have additive effects. For instance, THC and alcohol together can have stronger CNS, central nervous system side effects. They can have synergistic effects. For instance, THC and opiates are both used for pain management, and they kind of move through different pathways in the body to have this result of pain management. When they're combined together, they have a net greater effect on that specific issue. And they can have antagonistic effects where the drugs block each other, cancel each other out. Pharmacokinetic interactions are when one drug changes another drug's concentration. This can be impacted by timing. For instance, taking CBD before another drug or medication can affect that drug's absorption. So it's important to take CBD at least 2 to 4 hours after you take another medication that it has potential to interact with. These sorts of interactions alter the drug's absorption, distribution, metabolism, and excretion. And this occurs via the CYP450 liver enzymes. It's important to remember the adverse side effects possible with THC and CBD. And these are dose dependent. So you're more likely to run into these at higher doses. With THC, we're looking at dry mouth, dry eyes, sedation or drowsiness, dizziness, anxiety, elevated heart rate, which is usually transient, changes in blood pressure, postural hypotension, which is a sudden drop in blood pressure when changing position, disorientation, and cognitive impairment. THC side effects can be additive when combined with other drugs that depress the central nervous system, drugs that stimulate the sympathetic nervous system, or anticholinergic drugs. And some examples of these are CNS depressants or alcohol, benzodiazepines like Klonopin or Xanax, antipsychotics like Abilify or Seroquel, and opiates. Sympathetic nervous system stimulants include epinephrine, albuterol, and levobuterol, and anticholinergics include Dramamine, diphenhydramine or Benadryl, and doxylamine, as well as Flexeril or cyclobenzaprine. CBD side effects are found at pretty high doses, 10 to 20 milligrams per kilogram per day, at least over 400 milligrams per day. CBD side effects can be sedation, drowsiness, lethargy, weakness or low energy, and decreased blood pressure. And this potential effect on blood pressure means that it may have possible additive effects when combined with other antihypertensives like Lasix or HCTZ, or with other drugs that cause a drop in blood pressure like nitrates, levodopa, or antipsychotics. All of these side effects from cannabis, most people do develop tolerance to them. So it's really important to start with lower doses and slowly increase to develop the tolerance to side effects and also to monitor for drug interactions. THC can decrease some medication serum concentrations via the interactions with the liver enzymes. Some common ones to look out for are duloxetine or Cymbalta, naproxen or Aleve, and cyclobenzaprine or Flexeril. CBD may actually increase serum concentrations of some medications. This is because it slows the metabolism of these medications, which means that they have a higher, kind of kicking around your system a little more, and you have more side effects from them. So, this is similar to the effect of grapefruit. If your doctor's ever told you to avoid grapefruit, not drink grapefruit juice with a new medication, it's because it can have this same sort of interaction, slowing the metabolism, leading to more side effects. Important ones to look out for are warfarin, which can also be affected by THC, macrolide antibiotics like azithromycin, calcium channel blockers like diltiazem or amlodipine, beta blockers like propranolol, metoprolol, atenolol, benzodiazepines, sildenafil or Viagra, antihistamines, some statins like atorvastatin and simvastatin, but not pravastatin or rosuvastatin, SSRI antidepressants, and tricyclic antidepressants and antipsychotics. And some medications can also affect your THC and CBD levels. So, if you're initiating cannabis and taking these medications, or if you initiate a new medication while you're taking cannabis, you may need to adjust your cannabis dosages. Drugs that increase THC levels include clarithromycin, ketoconazole, fluconazole, diltiazem, and here's grapefruit again on the list, and some herbs, echinacea, chamomile, and licorice. Drugs that are known to decrease THC and CBD levels include carbamazepine, topiramate or Topamax, and phenobarbital. Some medications affect CBD levels only. Some that increase the CBD levels are fluoxetine or Prozac, proton pump inhibitors, ketoconazole, clopidogrel or Plavix, and fluconazole. And some that decrease your CBD levels include carbamazepine, St. John's wort. So if you're taking those, you might need to use higher CBD dosages. If you're using fluoxetine, for instance, you might need to decrease your CBD dose. So to conclude, CBD can interact with drugs like grapefruit does. This may lead to increased blood levels of various medications. THC and CBD can also cause changes in blood pressure. So you may need to adjust your blood pressure medications. Some people have been able to reduce their opioid dosages with the addition of small doses of THC for that synergistic effect. Alcohol may increase THC levels, so it's important to be aware of that if you're initiating cannabis when you have your martini at the end of the day. And in terms of warfarin, levels can be increased by both THC and CBD. This may cause an increased INR, and you may need to adjust your dosage. It's really important to talk to your PCP or specialist about potential drug interactions. And these interactions may actually have a positive effect because you can be able to decrease dosages of certain medications that have negative side effects. When you see your cannabis NP or MD, bring your entire medication list so she can alert you to any possible interactions that may come up. And here's a list of resources if you're interested in learning more. And thank you so much for joining me.